Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pneumococcal infections. Introduction. Pneumococcal infections are caused by bacteria. The bacteria can cause different types of infections throughout the body. Pneumococcal infections may be mild or severe. They can be treated with antibiotics. In severe cases, complications of pneumococcal infections may lead to death. This program explains pneumococcal infections. It also discusses symptoms, causes, treatment, and prevention. Pneumococcal infections. Pneumococci are a type of Streptococcus bacteria. The bacteria often live harmlessly in the throat of healthy people. Sometimes these bacteria will cause an infection. The bacteria spread through contact with people who are ill. They can also spread through contact with healthy people who carry the bacteria. Pneumococci bacteria mainly spread through tiny droplets. The droplets spread through the air when an infected person coughs or sneezes. If another person breathes in the droplets, they could become infected. The bacteria may also spread through contact with an infected object. Pneumococcal infections are more common in winter and early spring. It may take 1 to 3 days after being exposed to the bacteria for symptoms to appear. Pneumococcal infections can be mild or severe. They can affect many different parts of the body, including the bloodstream, heart, lungs, membrane lining the eyelids, membranes around the brain and spinal cord, middle ear, sinuses, tissue that covers abdominal organs. Pneumococcal infections can affect many different parts of the body. The following sections talk about the different types of infections that may be caused by pneumococci bacteria. Common pneumococcal infections. Meningitis is one common infection caused by pneumococcal bacteria. It is an infection of the thin tissue around the brain and spinal cord. Bacterial meningitis caused by pneumococci is rare, but it can be deadly. It can block blood vessels in the brain, leading to strokes and brain damage. Meningitis can cause confusion and drowsiness, fever, headache, nausea and vomiting, stiff neck, hearing loss. Ear infections are common in babies and young children. These infections may be caused by pneumococcal bacteria. An infection that affects the middle ear is also called otitis media. With otitis media, the tubes inside the ears become clogged with fluid and mucus. This can affect hearing. The small bones in the middle ear that transmit sounds cannot move freely. Otitis media can cause balance problems, ear pain and discharge, fever, irritability, poor hearing or hearing loss, diarrhea and vomiting. The sinuses are hollow air spaces in the bone surrounding the nose. The sinuses produce mucus, which drains into the nose. The sinuses may also become infected with pneumococcal bacteria. A sinus infection caused by pneumococci often starts as a cold. A sinus infection can cause congestion, cough, fatigue and weakness, fever, mucus drainage at the back of the throat, sinus pain and pressure. About 25% of cases of pneumonia are caused by pneumococcal infections. Pneumonia is an infection of the lungs. Pneumonia causes severe inflammation of the lungs. Tiny air sacs in the lungs, known as alveoli, fill with fluid. This may decrease the amount of oxygen in the blood. Pneumonia can cause chest pain, cough, fever, headache, lack of energy, loss of appetite, shortness of breath. Sepsis is a life-threatening illness. It is usually caused by the body's response to a pneumococcal infection. The pneumococcal infection makes the immune system go into overdrive, which causes the blood to act abnormally. Small blood clots form and block blood flow to vital organs. This can lead to organ failure. Sepsis can cause chills or shaking, dangerously low blood pressure, confusion or lightheadedness, fever or low body temperature, joint pain, rapid heartbeat, skin rash, warm skin, or bruising. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Other pneumococcal infections. Less commonly, pneumococcal bacteria may cause cardiac infections. Cardiac infections affect the heart. Two examples of cardiac infections are endocarditis, which affects the heart's inner lining, pericarditis, which affects the sac that surrounds the heart. About half of all cardiac infections are caused by pneumococci. The bacteria may enter the bloodstream and travel to the heart. They may settle on damaged heart valves. The bacteria can grow and form clots that travel to the brain, lungs, kidneys, or spleen. Most people who develop cardiac infections have existing heart problems. The infection can cause abnormal urine color or blood in the urine, chills, fatigue, joint pain, muscle aches and pain, paleness, shortness of breath, sweating, weakness, weight loss. Pneumococcal bacteria may also affect the membrane lining the eyelids. This membrane is called the conjunctiva. Conjunctivitis, also called pink eye, is the swelling of this membrane. It can cause blurred vision, crusts that form on the eyelid overnight, eye pain and itching, eye redness, light sensitivity. Peritonitis is the infection of the membrane that lines the inner abdominal wall and covers organs in the abdomen. The infection may be caused by pneumococcal bacteria. It can cause abdominal pain, bloating, diarrhea, fever and fatigue, nausea and vomiting, loss of appetite. Diagnosis. Your healthcare provider can diagnose a pneumococcal infection based on your symptoms. He or she will perform a physical exam and certain tests. The types of tests will depend on the location of the infection. Tests may include a chest X-ray to detect pneumonia or a cardiac infection, a CSF test to detect meningitis, a sinus X-ray to detect a sinus infection, blood tests to detect the presence of pneumococcal bacteria, hearing tests to detect otitis media, sputum tests to detect pneumonia. Other tests may also be done. Talk to your healthcare provider to learn more about a test before you have it done. Treatment. The main treatment for pneumococcal infections is antibiotics. Antibiotics can kill pneumococci bacteria. Take all of your prescribed medicine. If you stop prescribed medicine too soon, it could cause the infection to come back. This can make it much harder to treat. Follow your healthcare provider's instructions. Take all of the prescribed doses on time. Medicines to treat the symptoms of pneumococcal infections may also be prescribed. These include drugs to relieve pain and control fever. If symptoms include severe diarrhea and vomiting, fluids may be given to prevent dehydration. Prevention. Vaccines can prevent some pneumococcal infections. There are 2 vaccines. One is for infants and young children. It is recommended for all children at 2, 4, and 6 months of age. The other vaccine is for people at high risk, including people who are over 65 years old, have chronic illnesses such as asthma or diabetes, have heart, kidney, or lung disease, have weakened immune systems such as patients with HIV or cancer, live in long-term care facilities, smoke or drink heavily. For a person who is first vaccinated at the age of 65 years or older, revaccination is recommended 5 years later. In some people with a high risk of infection, continuous antibiotic treatment may be recommended.
Vaccination is recommended for children with certain medical conditions at 12 months of age. Some of these medical conditions include cerebrospinal fluid leaks, chronic kidney failure, chronic lung disease, cystic fibrosis, Down syndrome, heart disease, HIV, spleen problems, weakened immune systems. Vaccination at 12 months of age is also recommended for children receiving certain drugs or radiation treatment, children who were born premature, children with intracranial shunts or cochlear implants, insulin-dependent children with diabetes. It is also recommended that children who receive a vaccination at 12 months due to a health condition also get revaccinated at 5 years of age. Other steps can be taken to prevent pneumococcal infections. Wash your hands often to keep them clean. Wash them for at least 20 to 30 seconds. Next, dry them with a disposable towel. Use a second towel to turn off the faucet. You can also use a hand sanitizer containing at least 62% alcohol. Cover your mouth and nose with tissue paper when coughing or sneezing. Dispose of the soiled tissues properly and then wash hands thoroughly. If you do not feel well, avoid visiting crowded public places. If you have symptoms of a respiratory infection, wear a surgical mask.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pneumococcal infections are caused by bacteria known as pneumococci. The bacteria can cause different types of infections throughout the body. Pneumococci bacteria mainly spread through droplets that enter the air when an infected person coughs or sneezes. Pneumococcal infections can be mild or severe. They can affect many different parts of the body, including the bloodstream, heart, lungs, membrane lining the eyelids, membranes around the brain and spinal cord, middle ear, sinuses, tissue that covers abdominal organs. The main treatment for pneumococcal infections is antibiotics. Antibiotics can kill pneumococci bacteria. Medicines to treat the symptoms of pneumococcal infections may also be prescribed. These include drugs to relieve pain and control fever. Vaccines can prevent some pneumococcal infections. There are 2 vaccines. One is for infants and young children. It is recommended for all children at 2, 4, and 6 months of age. The other vaccine is for people at high risk, including people who are over 65 years old.
Thank you for using Explain.